Welcome to Ladies Talking Love, episode 78, Pregnancy and Sex. It's Ladies Talking Love, a community of women uncovering more joy and fulfillment in sex as we learn from experts and amazing women like you. Together, let's create a world where women's sexuality is celebrated and understood, beginning with our own. I'm your host, Ariel Finlinson. Let's talk love. I don't know if you felt anything like me, but I've been in my doctor's office with my midwife or OBGYN, and they ask, do you have pain with sex? Or how do you feel about sex? And it's kind of this moment of like, yeah, of course I'm fine. And even if I've had questions of like, oh, I'm actually experiencing some pain now with intercourse that I'm pregnant, or I've had some spotting after intercourse. And these questions that they ask, this is a safe space, or it should be, for women's health where we can ask any questions. But sometimes I felt nervous. And then I've heard women talk about being pregnant and they say that their doctor has recommended that they don't have sex. And in my head, I wonder, does that mean no intercourse or no orgasms? Are you still able to have stimulation of your vulva, but just not intercourse? If it was me in that position, would I feel comfortable clarifying that? These are all things that have gone through my head, and I don't know if you're the same, but if you are, in this episode, we are diving into a lot of those questions that may come up for you about pregnancy and sex. Is intercourse safe during pregnancy? When may it not be safe during pregnancy? Is outer course or stimulation of the vulva and clitoris always safe during pregnancy? Or are there times where that might not be safe as well? We are diving into all of that today with Stacy Hepner. Stacy Hepner is a certified nurse midwife at Budge OBGYN. She loves what she does and loves the team that she works with. She enjoys spending time with family and friends and also enjoys reading, exercising, and gardening. I'm so excited to welcome Stacy Hepner onto Ladies Talking Love. Thanks so much for joining me, Stacy.
Yeah, thanks so much for having me. I'm happy to be here.
I love having health professionals on. I want to make sure we're getting accurate information. And today we're diving into sex and pregnancy, which I think is a really common question that come up for women when we're pregnant. But I know for me, I never really asked the questions or knew what to ask. And so I'm really excited to dive into this topic with you today. Could you start off by just sharing a little bit about how you got interested in women's health and kind of your journey of becoming a midwife?
For me, it's always been women's health. It's just been my passion since the very beginning. I started working in a lab as a phlebotomist in an OB office, and it just jumped from there. There was a minute in nursing school where I thought, ooh, oncology is the place for me. Such meaningful, deep work, but never enough pull that it pulled me away from pregnancy, birth, and taking care of women.
Oh, that's so awesome. And how long have you been practicing?
I graduated as a nurse in 2010 and have been doing postpartum, labor and delivery OB offices ever since.
So great. I'm so excited to have you on. Can you tell us what are some of the misconceptions about sex during pregnancy? And when I say sex, I mean, I want to cover both, like outer course, the stimulation of the outer part of the vulva versus intercourse as well. Because I think a lot of times when we talk about sex, we talk about intercourse, but I would love to get both of those misconceptions that might come in, you see in your office.
These are such great questions. And one thing that I always try to do is I want women to know that they can come to our office and they can feel safe asking any of these questions. None of it is taboo for us. We may not know the answers, but we'll navigate it and help. But it's always a safe place. So I'm really glad that you're opening up this dialogue today too. And I think one of the ways I want to answer this question is talking about what is safe in pregnancy rather than what is not safe. So I think sex is generally safe in pregnancy. There's a few conditions where we recommend pelvic rest, which those would be like placental abnormalities like Penoprevia.
Can you define these terms as you're going? So women listen, you're like, wait, what's that?
Yeah, so if your placenta is covering your cervical os, that's called a placenta previa. In that case, intercourse could cause bleeding and different things like that. So that's a very specialized case, though. If everything is normal in your pregnancy, sex is safe. And there's some instances where you have a short cervix or history of preterm birth. So some of those instances, that'll be a conversation with your provider specifically, and they'll let you know. But if everything is normal and everything is regular in your pregnancy, then it is safe to have sex. And like you were saying, stimulation to your vulva, that is safe. Having an orgasm can create contractions. So some instances it might make a woman more uncomfortable to just contract. It's not going to cause preterm labor. It's not going to cause you to go into labor unless you're really ready to go into labor anyways. That's one thing I always say is what got you into this mess is going to get you out of this mess. But that's when your body's ready to go.
Yeah.
Sex will not harm the baby. Penis is not going to hit the baby's head. It is very well protected within the amniotic fluid. It's up past the cervix. So I think that's a common misconception. I think the dads are often worried.
Yes.
More than the mom about intercourse during pregnancies.
I'm so glad that you brought all those up because I've definitely heard that so much, right? Like, oh, I'm going to hit the baby's head with my penis. Hearing that misconception from women telling about their husband, like, oh, they're worried. So I think bringing all of those up is so helpful. Can you tell us, is there ever a time where like vulva stimulation of the clitoris where there is not intercourse or penetration is unsafe to reach orgasm or just have stimulation?
It's totally safe. Like I said, if you're having preterm contractions and you have an orgasm, it's going to release that oxytocin and cause more contractions. So in an instance like that, we might ask you to hold off on all pelvic rest is what we call it. No tampons, douching, sex, orgasms. But any other time, it is completely safe. Clitoral stimulation, anal stimulation, all of those things. It's safe to use toys. And the only rule with toys is just to do the same thing you would do when you're not pregnant. Wash them appropriately, and use all of those hygiene measures that you normally would, but they're absolutely safe in pregnancy. And that's a common question that we get.
I remember hearing women talking about like, oh, I can't have sex. My OB told me. And of course, you talked about like some of those rare things that might happen. It's not a super common thing. But I've always had that question because I'm like, did your provider talk with you that you're still okay to do things that aren't intercourse? And so I love that you're kind of separating that. Like if you have preterm labor, an orgasm could cause those contractions, but
well, I think that's really important too, because it can really affect your relationship if you have to have pelvic rest. That leads me into another topic of libido in pregnancy. Some women have a higher libido in pregnancy, and that's because of the increased blood flow to the vulva. Some women have a decreased libido, and it can be because of hormones, fatigue, nausea, breast tenderness. It's just a variation. So I think the really important key here is just to, one, talk with your partner. And this is kind of what led me into that discussion is even if you are on pelvic rest, you can communicate with your partner about ways to get creative, changing your positions, right? Sometimes that pregnant belly will get in the way of some positions, but you can be very creative and meet both of your needs. And sometimes, honestly, the women's needs are higher in pregnancy than the man. It really varies. So I think just communicating with your partner is the number one thing that I can say about libido in pregnancy.
I'm glad you talked about it is a struggle. Your body has changed. The positions might not be as comfortable. Are there positions that you would recommend that women could try that might be more comfortable when they're pregnant, especially later on in pregnancy?
Yeah, entering from behind. That's the easier way because the belly is out of the way. Side lying, lots of different things that you can try, but that's where you get to get creative with your partner.
And just find what's comfortable, find where you're at.
Yeah, exactly. If it's comfortable for both of you, it works.
What would you suggest for women as their body changes? It can be hard because I talk about this a lot on my podcast, but we're going to dive in a little bit with pregnancy today. There is such a big focus for women with sexual interactions with their partner on their body image. And I think too much. We often focus on how we look too much. We won't go into that today. You can listen to other episodes. We talk about this. But what would you suggest for women? Because it is a struggle. It can be a struggle when we focus or are thinking about our body image and our partner's sexual desire to be intimate with us. And as our body changes in pregnancy, it can be hard to feel comfortable in our own skin and to feel like we could be attractive to our partner. What are some suggestions you would give to women to help with body image as their bodies are changing?
I think that's a really great question. And it can be really hard in pregnancy to watch your body change, especially for women who have struggled with eating disorders or body image issues in the past. And in that case, I would say it's just really important, one, not to compare yourself with anyone else, like get off social media, don't watch any of those things. This is your body, your journey. And then number two, I think focus on what your body is doing for you. And if you can think about the miracle that is in your body and the things that your body is doing, maybe watching some of those stretch marks come or the different curves that come, you can really embrace that with love. And majority of the time, I see partners of the women that I take care for really embrace their partner's body changing as well. And I think for any of the men listening, that is really important to verbalize if you feel those wonderful changes that your partner is experiencing. You know, when you feel the baby move outside, or when you see that her breasts are developing so that they can feed your child. I think that is really important to focus on all of those things. And then finally, I think it's important to set realistic goals. We know what a healthy amount of weight gain is. And we can talk about that if you want to. I don't know if that's interesting, but I think it's really important to set realistic goals, try to eat healthy, nutrient dense food, get out, move your body and do healthy movement. And I don't even think you should really pay attention to the scale.
Yeah.
I mean, we weigh you when you come into the office. If you don't want to know what your weight is, we don't have to tell you that. But I think if you're moving your body in ways that feel good to you and you're choosing nutrient dense food, I think you should really let the rest fall away.
I really love that focus. I have struggled with an eating disorder in my teen years. And so during my first couple pregnancies, I remember, this is so embarrassing, but this is where I was at. Like, I remember comparing my weight of the different pregnancies and where I was at and like trying not to be heavier than my first pregnancy and just all of these things that were really hard. And because of my struggle with body image and my eating disorder, but now I've gotten to a place, and I love you mentioned this, when I go to the doctor, even when I'm pregnant, I turn around and I ask them not to tell me my weight. And I trust that if there is an issue with my too less of weight gain or too much, they are going to let me know. So I just focus on moving my body and trying to eat healthy as much as I can. During the sick part, I just try to eat what I can. But like focusing on that and not knowing my weight has been really helpful for me.
And it's tricky too, because, you know, it's really important. I think one of the most important aspects of a healthy pregnancy and birth is how you feed your body. Food is medicine or poison.
Yeah.
We can slowly poison ourselves over time. And it really does affect things like diabetes and high blood pressure. And moving your body is so important. But I don't ever think it should be about a number on a scale. I think it should be about exactly those things: preventing diabetes, giving your body healthy nutrients to make a baby out of so you can prevent those changes that come from diabetes.
And I loved what you talked about, focusing on the miracle of you growing a baby. And that's been really helpful for me in my journey of body image as well, that I try to think about that I want my body to kind of be a testament that I've lived. I don't want to go back to my teenage body because she hadn't lived. I love being able to see, even though it's hard sometimes, like see how my body's changed, because through my body, I'm like, I have birthed children and I have lived, and my body shows that. And yes, I want to take care of her and I want to exercise and eat good food.
Sure.
But I love that the changes show that I've lived, and that's been a helpful mind shift.
And there was a literal life in your body.
Yes.
And that comes with stretch marks and changes and loose skin. And so I think it's important too, like I said, stay off social media. Those things are not true. They're not real. And I always wear my bikini to the beach and sport all my stretch marks because those are my trophies. And that's easy to say, but it's true. Those are our trophies that we get. And I'm lucky to have a very supportive spouse who has grown with me and sees that my body did grow our children and things like that. And I can say from my own experience, for partners out there, validate your spouse and their changing body. I think that's really important.
Yes.
And then there's also support groups online that you can join. There's different applications that can help you move your body in pregnancy. One that I love specifically is called the Wilma app. She just helps you know like what is safe during pregnancy and how to move your body. And as your belly grows, just different exercises that might grow with you.
Oh, that's awesome. And when we talk about, you talked a little bit about the changes in sexual desire or libido, and that for some women during pregnancy, it can totally happen where you're wanting to be intimate more often. And that's a normal thing. And then for other women, it can be the opposite. Like, I do not want to be intimate. What would you advise women if they're struggling feeling desire to be intimate with their partner? What are some ways that they could stay connected physically, even if they're not feeling a lot of desire?
I really think the number one thing that you can do, this is even when you're not pregnant, it can change from the first trimester to the second trimester to the third trimester. It's not one size fits all for each woman. It's just to communicate with your partner, because your partner might be feeling one way or the other. They might be feeling sad that you're not desiring them. They might make it about them. And just let them know, you know what? I am so nauseous. My breasts are very tender. I don't want to be touched in that way. And that's when you need to really get creative in making sure that both partners' needs are met. If your libido doesn't match up, then I think that's where you really need to have that conversation with your spouse and reconcile it there. And you can be intimate in many other ways other than just intercourse, snuggling, back rubs, touching, watch a show, cuddle up, give a foot rub. So there's so many other ways that you can connect if you're not feeling like you want to have intercourse. But I do think it's just really important to communicate that with your spouse so they don't misinterpret the way you're feeling, or you misinterpret the way they're feeling.
Completely. That's huge. And I feel like libidos are pretty much never the same. Most couples, that's a very common thing in pregnancy. That's going to be the same. And I love how you talked about, I think that's the most important thing. Communicate with your partner. And if you aren't feeling like you can connect physically through sex, then find other ways to connect. And you gave such great examples. And I know you mentioned this, but can you list it for us again? Of course, you should only get this from your provider. They would be the ones to tell you. But when are the instances when intercourse is unwise during pregnancy? What are some of those conditions?
Yeah, placenta previa, which is where the placenta is covering your cervical os. That would be an unwise time to engage in intercourse. History of preterm birth or a short cervix. You have a cerclage in, which is where some stitches in your cervix. It's if you have a short cervix for a history of preterm birth. And then if you've had bleeding in pregnancy that's unexplained. And that's another good thing to mention too, is the cervix is really vascular in pregnancy. And so sometimes you can have spotting after intercourse. That would be from your cervix. And we're not really concerned about cervical bleeding. So that would be defined as spotting on your tissue paper after you wipe after intercourse. But if it's anything heavier than that, then we'd be concerned about placental bleeding, which we get really worked up about. And so if anyone's ever having a hard time determining if it's normal or abnormal bleeding, just come in. We will help you. You don't have to try to determine that on your own. Always err on the side of coming in, peace of mind. But some spotting after intercourse can be normal in pregnancy just due to that vascular cervix.
That is so helpful. And outer course orgasm is fine always, except for if your provider says not to. And that would be, you mentioned like preterm labor, right? Is that one of the only times you can think of off the top of your head?
Yeah. So when a woman has an orgasm, she releases oxytocin, and Pitocin is a synthetic form of oxytocin. So your brain releases that. So it can cause uterine contractions. Like I said, if you have a nice thick cervix and your pregnancy is all normal, then it's not going to make you go into preterm labor. But if you have talked with your provider and your cervix is extra short and they say it's unsafe, those are the only instances. We will let you know in your pregnancy if we feel it is unsafe.
If you're confused, just make sure and ask. That's why I wanted you to go over them again, because I feel like for me, sometimes I'm nervous to ask, which I'm like, I shouldn't be. And I don't think I would be as much now after doing this for years. But like, I remember feeling so nervous to ask these type of questions. And I want to empower the women listening to be able to ask. If your provider says, you shouldn't have sex, clarify, say, oh, am I still okay to have stimulation and orgasm as long as there's no penetration? Like, just clarify so you know, and you can connect in the ways you want to while you're pregnant.
And like I said, we want you to always feel comfortable asking all those questions. No questions are off limits. You can't make our jaw drop. It is the place we work, and there's no judgment. You're here to get the care, and we want to answer all of your questions. Those are really great questions. I was talking kind of about in pregnancy, but once you get to labor and, delivery part, once your membranes are ruptured, that would be another time when we don't recommend intercourse, because it just increases your risk for infection once your water has broke.
Especially if you're using an orgasm to induce labor. Make sure if your water's broken not to have intercourse.
Yeah, and at that point, you can still have clitoral stimulation and things like that. You can still have orgasm. We just don't want that semen inside causing place for infection to brew.
I'm so glad that you brought that up, because that is so important, especially depending on, you go with a midwife, you might have your water break, but not go in and get induced for a whole day or whatever it is. And so thank you for bringing that up. I'm so glad, because it is so helpful, and we don't have time in a 15-minute appointment to always talk about this. So that's why I wanted to have you come on and share some of this with us. Can you talk about some of the chronic conditions that women experience during pregnancy?
Some of the chronic conditions are the same as women who are not pregnant. And so that would be high blood pressure, diabetes, sleep apnea, things like that. But some chronic conditions that are specific to pregnancy, hyperemesis in that first trimester, which is just extreme nausea and vomiting. And then sometimes people will get vulvar varicosities or varicose veins, are kind of chronic in pregnancy. And then changes that happen in your body can cause chronic pain, like sciatic pain, nerve pain, things like that. So there's a few different things that people can experience during pregnancy.
Can you define the vulvar varicosities and sciatica?
Vulvar varicosities, it's just the same as like a varicose vein. You can think of it the same as a varicose vein in your leg, except for it's in your vaginal area. And they can thrombose. They can be very uncomfortable. Honestly, the best treatment is with a vein specialist postpartum, which is what makes it kind of tricky. That's why it's that chronic. You kind of have to learn to manage your symptoms until after the delivery of the baby, when we can refer you out to a vein specialist who can kind of evaluate and treat that further. But things that you can do in pregnancy, you can wear compression socks, elevate your legs, make sure you're getting plenty of water, make sure you're keeping your bowels soft so you don't have to strain for bowel movements. Pregnancy can slow your bowels down, and so women will experience constipation sometimes. So if you need extra assistance learning how to move your bowels, you can talk with your doctor about which options are best for you. But that's something to just consider, is keeping your bowels soft so you can minimize the risk for those varicosities in pregnancy.
And does that make sense? The vulva probably is more swollen with the varicose veins in the vulva. Is intercourse usually more painful for women who experience that?
Yeah, I'm glad you asked that. It can be more painful. And so in those cases where women are complaining of painful intercourse or pain with sitting, I mean, you can get donut pillows and different things like that to kind of help, so you're not sitting right on where the extra pressure is. But I think pelvic floor physical therapy is huge. And sometimes we underutilize it and we wait until postpartum to kind of recover. But you can see a pelvic floor physical therapist in your pregnancy. And I've had so many women say that it helps so much. Like, they can't sit in the car for more than an hour. They're going somewhere. And then after they meet with a pelvic floor physical therapist, they're like, oh my goodness, I went on a 3-hour drive and I was no longer uncomfortable. And I could sit down on the floor and play with my kids. And intercourse was more comfortable. And so there's definitely things that we can do. Like I said, we don't really treat it until postpartum.
Yeah.
But there's things that we can do to manage it. So if you're experiencing that, just talk to your provider.
Yeah. And they can recommend a pelvic floor physical therapist in the area, or I can do the link. You can look up a pelvic floor therapist provider in your area based on zip code.
There's so many great ones.
Oh, and I'm so glad you mentioned pelvic floor physical therapy, because I didn't know about it until after my second child. And I wish I had known of that option, because it's so impactful.
I wish it was just part of the pregnancy package.
Me too. Let's change that, Stacy.
I agree.
And then can you define sciatica for people as well?
That's just when the nerve in your back gets pinch, and it can send that shooting pain down one or both legs. Usually it's one leg. And it makes so much sense that these kinds of pain would come in pregnancy, because it's not just your belly that changes, it's your skeletal system. Your placenta releases relaxin and your joints are just a little bit looser than they used to be. There's a head down there in your pelvis. It just makes so much sense that people have that pain in pregnancy. And I think massage therapy, yoga, chiropractic work, and I would recommend one that's certified in pregnancy, and they're just a little more gentle with the pregnant patient. And stretching, physical therapy, a bunch of things that you can do for sciatic pain as well. You don't just have to suffer until you deliver.
Yeah.
But I will say as well that I do think that some discomforts of pregnancy are normal.
Yeah.
It's just like setting that normal expectation for your body as it's changing and growing. I always say that if you weren't uncomfortable, you wouldn't be brave enough to push out an 8-pound bowling ball. If you were always comfortable, some of those discomforts make you brave.
Yeah.
Just learning the comfort measures and being able to sit and be present with some of those discomforts, the ones that are normal. Like you might have a little bit of hip pain. You might have a little bit of twinging in your skin as it's stretching and growing. Sciatic pain isn't normal, common, but
yeah.
So I think embracing some of those normal changes is really important too.
Yeah. And then asking your provider and doing what you can to make yourself more comfortable, especially with the ones that like sciatic pain and things that you can work with. Can we talk for a minute just about the changes that happen with our breasts during pregnancy? You talked about that they can become a lot more sensitive. Can you tell a little more about what happens with our breasts during pregnancy?
Yeah, I think that's really important what you say, to be able to like use your voice and communicate, because no one can read your mind. No one knows how you feel. And that can
Even
be
though that'd be
tricky.
really nice. That would be so nice if people could read my mind, but they can't.
But as your body is getting ready and your breasts are getting ready to make milk and nourish a little human, there are changes that happen. And so once your placenta is detached from that uterine wall, that's when the cascade of hormones happens for you to actually make milk. Before then, it's just colostrum. So women will also come and say, why am I leaking at 24, 28, 32 weeks? And that's common. There's nothing abnormal about that. Your breasts and your body are just getting ready to nourish a baby. And so that's why they're tender, because you're having lots of changes. And so after you have your baby, so postpartum, day 2 or 3, whenever your milk comes in, you'll have a different kind of tenderness from being engorged and also from having the baby suckle. Like you'll have to develop those calluses on your nipples and things like that. And again, it just varies so much from woman to woman, which is why I can't give a generalized caveat here, other than listen to your body, know your body, and communicate with your partner about it.
Does this happen with most women as well, that your breast, I'm totally spacing the name for it, but the darker ring around your nipple, can you remind me what it's called?
Yeah, the areola.
The areola, thank you. I was like, I'm forgetting the name.
Yeah.
It usually gets darker and bigger. Is that correct for most women, or is that just depend on the woman?
It varies a lot from woman to woman as well, but it's very common. And the reason for that, it's like a bullseye for your baby. They kind of see in black and white. They don't really see very well. Their vision is locked in right at birth. But so if there's a contrast in the skin color, then that's the bullseye and they know where to go. So they use their senses and their sense of smell to smell that milk and things like that. And so some women will get a line on their belly. That's called the linea nigra. And it's that darkening of your skin. Some women will get darkening even on their face. And the reason for that is just so that it's a bullseye for that baby.
Oh, that's so interesting. I haven't heard it described that way before. And just as we're talking about nursing and getting your milk in, it can also be so common after giving birth for nursing moms for an orgasm or sexual arousal to make your milk come in. So if you're wondering, like, why am I leaking all over? You are so normal.
Yeah.
Put some nursing pads in or whatever, but
it's that same hormone, that oxytocin, the letdown reflex. You know what I mean? And that's why women, when they're breastfeeding, they'll feel those contractions and they'll say, oh gosh, I'm so crampy every time I breastfeed. And it's all just your body's amazing, doing all the wonderful things that it should be doing.
Yes, this has been so awesome. As we close up, can you just share a couple thoughts to tie it all together about what you wish women understood about sex and pregnancy?
I think I've said it a few times, but I do think it's worth repeating. I think it's just so important to get to know your own body. And you can come and ask us any questions. It's a safe place. We're not going to judge you. You can come here for STI testing. You can come here for questions that you don't feel comfortable asking anywhere else. And it's a safe place. And then just knowing that it's not one size fits all. So I wouldn't go and ask all of your friends how they feel about it, because it doesn't matter how they feel about it. It's you and your body and your partner. I do think it's really important to consider your partner's feelings, and that's where that communication comes in.
I love that. Thank you so much, Stacy. This has been so great. Did you have anything else you wanted to add?
No, I think that's everything. Thank you so much for trying to educate everyone. And I think these topics are really, really important. And so thanks for having these conversations.
Of course. Thank you so much for joining me.
I hope that this interview answered some of the questions that you may have not felt comfortable asking in your doctor's office. And I hope that Stacy helped you feel more comfortable so that when you're at your doctor's appointments, you can ask these questions without feeling as embarrassed or as uncomfortable, and knowing that they've heard it all. They are there to answer these questions for you, and you don't need to hesitate to ask them whatever's on your mind. I really appreciated the clarifications of times when it might not be okay to have intercourse, but still have orgasms or clitoral stimulation, vulva stimulation, and times when that might not be okay. It was really awesome because I have had these questions for a while, and I also loved her insight into embracing the changes in your body with love and encouraging your partner, especially if this is a sensitive topic for you, like it has been for me in my life, to show you and talk with you about how they see these changes in your body, because it can be hard for you to accept them. And if you're anything like me as well, I hope that you'll try it next time. Go in and turn your back and ask them not to tell you your weight. The scale and I, ever since my eating disorder in high school, have had a really unhealthy relationship. And knowing my weight isn't helpful. What I focus on is trying to take care of my body, trying to move my body, trying to eat well, and letting my body be where she's at with the weight she's at when I'm trying to take care of her. And I don't like to know that weight because I can hyper focus on it and obsess over feeling like I'm heavier than I should be, or feeling really good that I'm lighter than I thought I would be. And neither of those, I think, are healthy. And so I want to challenge you, if you haven't done that before, maybe you don't even know if you have a bad relationship with the scale, try it next time and see if anything changes for you. Maybe you'll realize, wow, that was actually better. And I do have a little bit of an unhealthy relationship with my scale. And if you have any questions, next time you go to the OB office or your midwife office, ask the questions that are on your mind. And when they ask you if you have painful sex, if you do, if you have painful intercourse, say yes. Tell them what is going on so that you can get the help that you deserve. As always, I'm so grateful to be learning with you and have you listening to my podcast. Thanks for talking love. Thank you to all of you who listen and join me on this journey, and to our Ladies Talking Love team who make the podcast possible. Thanks to our sound wizard, Kimberly Demers, and our miscellaneous task whiz, Melissa Havertz.